You're sitting on the toilet. You push. You strain. Nothing moves. It feels hard, stuck, like a rock sitting right at the edge, refusing to budge no matter how hard you bear down. You're not imagining it. And this is not just a little constipated. Here's what most people get wrong. Regular constipation means your stool is soft but slow. It's backed up, but it still moves. That's why fiber and gentle laxatives work for most people. They add bulk and speed things along. But if the stool has already gone hard and dry, and it's sitting stuck right at the exit, fiber won't help. In fact, it can make things worse. You can't push more soft material behind a hard blockage and expect it to squeeze through. It's like trying to force more toothpaste into a tube that's already jammed at the cap. The pressure builds, but nothing comes out. This is a different problem. It needs a different fix. In this video, I'll show you the fast at-home fix, why this happens more as we age, and how to stop it from coming back. Let's talk about why this happens. Think about clay. Fresh clay is soft. You can shape it, squeeze it, move it around. But leave that same clay out in the sun for a few hours, and it turns hard and dry. Now try to bend it. It cracks instead. It won't move the way it used to. That's exactly what happens inside your rectum when stool sits there too long. At first it's soft. But the longer it stays in place, the more your colon keeps pulling water out of it. That's actually your colon's normal job. It's built to absorb water from waste before it leaves your body. But when stool sits still for too long, the colon keeps absorbing and absorbing. The stool dries out. It hardens. And soon, it's not moving anywhere. This is the piece most people miss. Once that stool has turned hard and dry, adding more fiber doesn't soften it. Fiber adds bulk. It's meant to help softer stool move faster. But when there's already a hard, dry mass blocking the way, more bulk just means more pressure pushing against something that can't budge. It's like trying to push a fresh batch of clay through a doorway that's already blocked by a dried-out chunk. No matter how much soft clay you add behind it, the hard piece isn't going anywhere on its own. This is why so many people try fiber, drink more water, and still feel stuck. They're doing the right thing for the wrong problem. The stool isn't just backed up. It's hardened in place. And that calls for a different kind of help, which we'll get to next. So what causes this in the first place? A few things, and most of them get more common as we age. Reduced mobility is a big one. When you move less during the day, your gut moves less too. Walking actually helps push things along, so less walking often means slower digestion. Dehydration plays a role as well. If you're not drinking enough water, your body pulls extra water from your stool, and that only speeds up the drying out process we just talked about. Certain medications add to the problem too. Iron supplements, some blood pressure medications, and opiate pain relievers are known to slow down the gut. Weaker pelvic muscles, which can happen naturally with age, make it harder to fully empty the bowel each time. And ignoring the urge to go, maybe because you're busy or not near a bathroom, trains your body to hold on longer than it should. Add a low-fiber diet on top of all that, and you've got the perfect setup for stool to sit, harden, and get stuck. Now here's the trap almost everyone falls into. When stool won't move, the instinct is to strain harder. It feels logical. More push should mean more movement, right? But that's not how it works here. Straining harder just builds pressure against something that's already stuck in place. It doesn't soften the stool or help it move. Instead, it puts real strain on your pelvic floor muscles and the blood vessels around your rectum. That's often how conditions like hemorrhoids get worse, or new ones show up. The harder you push, the more damage you risk, with nothing to show for it. So what actually works when stool is hard and stuck? One of the most trusted first steps, the one doctors and pharmacists recommend most often, is a glycerin suppository. You can find these at any pharmacy without a prescription. Here's how it helps. Instead of trying to push more bulk in from behind, like fiber does, it works right at the site of the problem. It draws water into the hardened stool and softens it from the outside in. At the same time, it lubricates the area, making it easier for that stuck stool to finally slide out. Think of it like adding oil and moisture to a dried-out hinge that's been stuck shut. You're not forcing it. You're helping it move naturally again. Most people notice results fast. It usually works within 15 to 30 minutes, which is part of why it's such a trusted rescue option when you're in real discomfort and need relief now, not hours from now. Now, a few important cautions. This is not the right choice for everyone. If you have certain rectal conditions, active bleeding, or you're dealing with severe pain, skip this and check with a doctor first. Using it in these situations can do more harm than good. And here's something every senior watching this should remember. If you try this and it still doesn't work, that's your body telling you something more is going on. Please don't keep struggling alone at home. That's a clear sign to call your doctor. Sometimes the blockage is more serious, and a professional needs to step in to help clear it safely. If a suppository isn't the right fit for you, there's another gentle option worth trying. A warm sitz bath. This is simple. You sit in a few inches of warm water, just enough to cover your hips and bottom, for about 15 to 20 minutes. You can buy a sitz bath basin at almost any pharmacy, or just use your own bathtub with a small amount of warm water. The warmth works by relaxing the muscles around your rectum, the same muscles that tend to tighten up when you're straining or in pain. When those muscles loosen, it becomes much easier for stuck stool to move on its own, without you forcing anything. It's a slower approach than the suppository, but it's soothing, safe, and a great option if you're dealing with soreness or irritation in that area too. Now, let's talk about what to avoid. Many people reach for harsh stimulant laxatives when they feel stuck, the kind that force strong, urgent contractions in your gut. Used once in a while, they're not the enemy. But using them regularly is where the real trouble starts. Here's why. Your bowel has its own natural rhythm, a built-in system that tells it when to contract and move things along. When you rely on strong stimulant laxatives too often, your gut starts leaning on that outside push instead of doing the work itself. Over time, this can actually weaken your natural bowel function, making you more dependent on laxatives just to go at all. So think of harsh laxatives as a tool for emergencies, not a daily habit. Your gut works best when it's allowed to do its own job. Now here's something that costs nothing and you can do right now, using items you already have at home. First, grab a small stool or even a stack of books, and place your feet up on it while you sit on the toilet. This raises your knees above your hips, which straightens out the path stool has to travel. It's a small change that makes a big difference. Second, place your hand flat on your belly and gently massage in a clockwise circle, following the natural direction of your colon. This gentle pressure can help nudge things along without straining. Third, breathe deeply instead of holding your breath and pushing. Slow, steady breaths keep your muscles relaxed instead of tense. Remember that dried-out clay we talked about earlier? You can't force hardened clay to move by squeezing harder. But you can shift it, gently, with the right angle and steady motion. That's exactly what this technique does. It works with your body instead of against it, helping that stuck stool find its way out without adding more pressure to an already strained area. Now let's make sure this doesn't keep happening. 3 simple habits, done at the same time each day, can protect you going forward. First, drink a full glass of water first thing in the morning, before your coffee or tea. This wakes up your gut and gives it the moisture it needs to keep stool soft from the start of the day. Second, add a fiber-rich food to your lunch, like beans, berries, or a serving of oats. Fiber works best when your body has steady water intake to go with it, which is why pairing it later in the day, after your morning water, makes it more effective. Third, take a short walk in the evening, even just 10 to 15 minutes. Movement in your body creates movement in your gut, and an evening walk helps keep things flowing overnight. So remember it this way. Water in the morning, fiber at lunch, and a walk in the evening. 3 small habits, done consistently, working together to keep your system moving the way it should. Before we wrap up, let's fix 2 mistakes that quietly make this worse. The first is overusing enemas. They can help in the moment, but leaning on them too often teaches your bowel to wait for outside help instead of doing its own job. The second is ignoring the urge to go. Every time you hold it in, your body gets a little better at ignoring that signal next time, and stool sits longer, drying out even more. Here's the principle to remember. Consistency beats intensity. Small, steady habits done every day protect your gut far better than one big fix done occasionally. And that's exactly why so many people are turning to a daily fiber blend, one that gut health experts have recommended for years, to support regular, comfortable digestion without relying on harsh remedies. It's a simple way to build the consistency we just talked about, right into your routine. If you want to see the one many of our viewers trust, check the link in the description below. Now, let's talk about when a home remedy isn't enough, and it's time to call your doctor. Let's be clear about when it's time to stop trying home remedies and call your doctor. If you haven't had a bowel movement in several days, even after trying what we covered today, that's a signal to get help. The same goes for severe belly pain, vomiting, blood from the rectum, or a fever. These aren't signs to push through on your own. They're your body asking for real medical care, and that's nothing to hesitate over. Now, let's bring it all together. Start with a glycerin suppository for fast relief, or try a warm sitz bath to relax things naturally. Use the toilet position trick, gentle belly massage, and deep breathing to help things move without straining. Then protect yourself going forward with water in the morning, fiber at lunch, and a walk in the evening. Before we go, let's be honest. This happens to so many of us as we get older, and there's no shame in it. Your body has carried you through decades of life. It deserves patience, not embarrassment. Treat it with the same care you'd give someone you love, because that's exactly what it needs.